So we're going to go over insertion of your oropharyngeal airway. We'll go over 3 different techniques of insertion with you all, but just to review, you've got your Goodale airway and the Berman airway. You want to make sure that you appropriately size that for your patient, making sure that you go from about the midline of the mouth down to about the angle of the mandible. So although this one's bigger, both of these would actually, for this mannequin, would work out okay. As far as opening the mouth, your textbook goes over a scissor technique. So it's basically placing your finger and your index finger and your thumb on the thumb on the top teeth, index finger on the lower teeth, and just kind of making a scissor motion to open the mouth. So as far as the insertion technique, you can take your fingers in there and open the mouth up. And again, you want to make sure that your patient is unconscious, because if you put this in a conscious patient, you're likely going to tag the gag reflex and cause the patient to throw up. So you can do a 180-degree turn or a 90-degree turn, or you can utilize a tongue depressor and put it into place as well. So we'll go over all 3. So if you're going to do your 180-degree turn, you'll basically insert your oropharyngeal airway upside down. So go ahead and use the technique to open the mouth. And basically, you're going to ride the hard palate until you get toward the base of the tongue. Once you've gotten past the base of the tongue, or toward the back of the mouth, then you're going to take and rotate 180 degrees, and that is going to rest at the base of the tongue and help pull the tongue forward. So now you've got an airway in place to help pull the tongue forward and keep the airway patent. So if you're going to do the 90-degree turn, you'll still open the mouth up just like you would. You'll go in sideways with the airway until you get toward the bottom of the tongue or the base tongue, and then turn 90 degrees or rotate 90 degrees into place. Another way in which you can go about doing that is to take a tongue depressor, take the tongue depressor and press the tongue down, and at this point you can slide that into place as it needs to be. So once this is in place, you now have a means for bag valve mask ventilation. So in the event you're having to support their breathing with a bag and mask, you can provide free flow oxygen down the channel of the Goodale, or nonetheless go ahead and place your bag and mask over the mouth and nose, utilizing your C and E grip. Open the airway, and then you can provide positive pressure ventilation with your bag valve mask, or with your bag, watching for good chest rise and fall. So that's insertion of your oropharyngeal airway for the upcoming competency. Really shouldn't be that bad. You can utilize any one of the 3 techniques that I demonstrated. Some questions for everything. Know the indications, the contraindications, if there happens to be relative or absolute contraindications. Remember the difference in the 2. Relative meaning that the benefits outweigh the risk, and absolute means under no circumstances should you do that. We want to make sure that we're not putting an oropharyngeal airway, be it a Berman or Goodale airway. Want to make sure that they're not conscious, because if they are conscious, it's likely that you're going to hit their gag reflex. If you've got any questions on that particular procedure, how to do it, let me know, and I'm happy to answer any of those as they come up.